If you do something to try and compensate for eating, to prevent weight gain and get rid of calories, it's purging. It's purging. You might not want to call it that. You might not want to admit it, but it is. So, what is bulimia? And how do you know if you have it? There's so much misinformation and misunderstanding, and frankly confusion, even amongst clinicians working in the space, believe it or not. So, let's break it down properly. Alright, let's take Sam. Sam eats thousands of calories in a single sitting. Now, £1,000,000 question. Does Sam have bulimia? Of course, this is a ridiculous question. We don't have anywhere near enough information. We don't know. Maybe he does, maybe he doesn't. So let's work it out. For someone to have bulimia, they need 3 things. My name's Chuks, award-winning psychiatry doctor and best-selling author with a specialist interest in eating disorders. So, the first thing that someone needs to have for us to say that they have bulimia is 1. Binging. People tend to think binging is subjective, and it kind of is. What one person may think is a binge, another person might not, right? The Oxford Dictionary defines a binge as an instance of consuming large quantities of food in a short period of time, sometimes as part of an eating disorder. And respect to the Oxford guides for mentioning eating disorders here, because nowadays we use the word binge casually. And in the context of binging TV, binging films, books, in bulimia, a binge is 2 things. Firstly, a period of time during which an individual experiences a loss of control over their eating. Now, this loss of control may be someone feeling like they can't stop or limit the amount of type of food they eat, maybe finding it hard to stop once they've started eating, or even giving up trying to control their eating altogether because they just know they'll end up overeating anyway. So, a binge is a loss of control. And secondly, when someone eats notably more or differently than usual. And this is important because binging doesn't just refer to quantity. It also refers to a change in pattern or behaviour compared to your normal eating. Your normal eating. What's normal for you may not be normal for someone else. So, for example, binging could mean eating food you don't normally eat. Binging's always relative to the person. And most people, from my experience, can usually say what's normal for them. So there are so many different ways to binge. No one's experience is the same. Foods are different, quantities are different, reasons are different, physiological effects are different. And this is important because this is where people often go wrong when it comes to therapy. You want to choose a good therapist for this. A good therapist knows to thoroughly investigate a binge itself. This investigative work is like a whole thing, and we can't take any shortcuts here. When it comes to binging, people have asked me, what about eating faster than normal or eating alone? Now, these may happen as well, but they're not essential for a bulimia diagnosis. The ICD-11 and DSM-5 are 2 separate manuals that we use in mental health to diagnose different conditions. When it comes to binging, DSM-5 places more emphasis than ICD-11 on the volume of what's eaten and compares it to what other people may find a normal amount to consume. So let's go back to Sam and his thousands of calories in a single sitting. Let's say Sam eats a plate of tasty jollof rice, fried chicken, plantain, and maybe an egg and a little bit of coleslaw. If you know, you know. Delicacy. And let's say he washes it down with some super malt. Those of you that know me know that I think calorie counting is largely a nonsense, but that's a meal with a decent amount of calories in, especially if it's a larger serving. So let's say he eats it with his family every Sunday afternoon. Doesn't mean it's a binge. This could be perfectly normal. Yes, afterwards he may say, oof, I feel like I've eaten too much. But it doesn't necessarily mean it's a binge. There may have been no loss of control and may be what he normally eats. Overeating, which is what Sam may be doing, and I stress may because it all depends on his energy needs, is not the same as binge eating. Don't confuse overeating, which doesn't involve that loss of control, with occasional or stress-related binge eating, which are both extremely common, by the way. This is where millions of people sit, and it's massively under-discussed. Occasional binge eating is so common. I'm talking several people in a group of friends. In the UK, up to 30% of people binge eat without having a clinical disorder. That's 20 million people, whereas just 1% of those are thought to have bulimia. Similar numbers are seen in the US and globally. So overeating is different to occasional binge eating, which is different to binging seen in bulimia. Binging has to happen at least once a week for at least 1 month for it to hit the threshold for bulimia. If it's less than that, it's not bulimia. It may end up being bulimia, but it's not bulimia. It's not yet anyway. It may be another disorder, for example, OSFED, which we'll get to in another video. Eating disorder diagnoses are fluid, which is why it's so common to see people have one diagnosis but then it changes to another one with time. Those of us that look after people struggling with eating and body issues know that more important than diagnosis is the focus on the individual. That's more important. Diagnostic labels are great and validating, but I guess just not the most important thing in the world, he says whilst creating a video on bulimia diagnoses. Hey guys, Dr Chuks here. I hope you're enjoying today's video. So you guys know I started this channel to clear up a lot of misinformation out there and answer all of your burning questions when it comes to body and eating issues. But I need your help. Let me know in the comments those burning questions or topics you want covered. You know what we say here. If it's burning, we're learning. Let me know and I'll get straight to answering those for you. Back to the video. Binging often leaves people feeling guilty as though I should have control. Hence, here's the second thing that's needed for us to say that someone has bulimia. Purging. Now, purging is anything intended to cancel out food intake, not just self-induced vomiting, which people seem to always think. It could be using laxatives, extreme exercise, restricting food intake. Of course, there's a whole bunch of other ways, including culturally specific ways that people use to purge. And again, this needs to happen at least once a week for at least 1 month for it to be bulimia. Some of these purging methods can be hidden societally, especially something like exercise. That language of having to run off a dessert, for example, it's totally embedded with how we communicate societally and how we behave. Purging is so common. Many don't recognize it as disordered or risky, especially when it comes to exercise or fasting to make up for eating. Things like detox behaviours. I often hear, I don't purge. If you do something to try and compensate for eating, to prevent weight gain and get rid of calories, it's purging. It's purging. You might not want to call it that. You might not want to admit it, but it is. Purging is the main reason people with bulimia often have an average body weight, which more than often goes societally unnoticed. Bulimia is by far the most secretive eating disorder and notoriously hard to ascertain who actually has it. In the UK, we think it affects 500,000 people. In the US, we think 7.2 million people will experience it in their lifetime. But the reality is, we don't really know. Purging can also go unnoticed to the individual themselves and can gradually take over people's lives. I've seen this happen time and time again. It's incredibly subtle and incredibly sad. It's important to know that there's lots of different reasons for purging. So in clinic, we always delve deep to understand why someone has gone down this sometimes incredibly difficult to turn around road of purging. The DSM-5 categorizes purging as mild, moderate, severe, and extreme, which even though it's arbitrary, I think is great. From my experience, it can give us a good idea of how life impacting someone's behaviors have got. So mild is 1 to 3 episodes of inappropriate compensatory behaviour, moderate 4 to 7, severe 8 to 13, extreme is 14 or above. And so there's one last thing for us to reach a bulimia diagnosis: preoccupation with body. That classic eating disorders picture of someone looking in a mirror? It gives a misrepresentation of eating disorders as a whole, because not all eating disorders are about people who care about their body. But this being said, bulimia is one of those where it's really important for people to be preoccupied with their body. It's an essential criterion for diagnosis here. So when people think about preoccupation with body, they always think about doing things. Maybe someone who's obsessed with using scales or uses tape measures to measure different body parts, constantly looking in the mirror, obsessed with checking calorie content of food, searching relentlessly for information on how to lose weight. That's doing. But preoccupation with body can also mean not doing. People often forget these. They're far more subtle and often go unnoticed. How about not having mirrors at home? Or maybe avoiding tight-fitted clothing? Maybe refusal to know your weight? Preoccupation with body shouldn't be too subjective. This isn't the same thing as caring about your body or even thinking about your body. Most people do that. When someone's completely preoccupied with their body, it's pervasive. That is, has a significant impact on someone's life and often occupies a great deal of mental space. Right, well, that's it. I need to go find out how Sam's doing. Oh, and one other thing, the ICD-11 has distress as a requirement for bulimia. The DSM-5 doesn't have this. And I kind of understand why the DSM-5 has left this out, because the reality is, if you're preoccupied with your body, then the chances are you're going to be distressed anyway if you binge and purge. Well, guys, I hope that's helped. Some of you have asked me privately to make a video explaining why some people are more likely to binge than others and what we can do about it. So I'll get on it. Make sure you subscribe so you can check out the latest videos when they do eventually drop. Take care, guys, and hold on to hope.